Well, I'm here today with Dr. Jeff with Hillside Chiropractic. Dr. Jeff, I've heard you say, give me 3 treatments and I'll show you results. Help me understand what that means from your perspective and the type of patient that you look for in giving them ART and chiropractic treatments.
Right. I mean, I want an ample opportunity to actually show what ART can do. You know, it's a proven process, but it's not a miracle worker that's going to get better in one visit. I don't want those expectations. I want the patient that actually expects to contribute to their health and really wants to get better and go through the process and actually get their active lifestyle back. If you're looking for a one and done type of thing, well, that probably isn't the right spot for you. You know, that's something you take a medication for to cover up the symptoms. I want to actually get stuff better, and it can't get better in one visit. And I've heard a lot of stories of people saying, I went to the chiropractor one time, it didn't get better, so I didn't go back. Well, that wasn't enough time. I don't care who you are, no matter what kind of thing you do, one time is not enough. And what we do is, the first treatment, I tell people, you should feel a little bit better, you should feel looser after you get up after the first treatment. After the first ART is done, the muscles are going to be moving better. But part of the ART process is that we have to retrain those muscles, re-educate them to do their job the way they're supposed to. And that doesn't happen in the first one. Usually, I always tell people, I can explain it as, you work that muscle and the body says, okay, what the heck was that? And goes right back and says, I'm not ready for that. Well, then I have to do it again the next time. And then it kind of says, okay, now you're making me do this again. Maybe I can start to do it. So I tell people 3 times. After 3 visits, you might not be all the way better, but you can tell that we're on the right track. You're starting to feel better, you're starting to feel looser, and the muscles aren't getting as sore. I use it the same way like you go to the gym. If you go to the gym the first time you work out, you don't feel great, your muscles aren't buff, you aren't lost a lot of weight, and you feel really sore. And that can happen with the first treatment. You know, you're going to be a little tender because we're working muscles, we're teaching them how to work the way they're supposed to. And each time it gets better, lasts longer. It's, you know, in 14 years of treatment, I've seen a lot of people come through here that, you know, realize that I have to give them the 3 treatments, and they think that the first one is like, oh, I didn't feel that great, you know, it's a little sore. And by the time you get to the 3rd one, they're better and they're committed to going the haul.
So when you pick these patients that are listening to you, I would imagine they would think, if I just go work out every day, I won't need this. So what benefit do you bring from an outside perspective that would either complement working out versus just working out on its own?
Right, that's probably the most common misnomer I see in my clinic is that people think, I run, I work out, I use my muscles all the time, why do I need ART? I shouldn't have any problems with it, their muscles are toned and working. So yeah, when you work them out a lot and you use them a lot, they get overused too and they get scar tissue in there. A part of the process of lifting weights and building muscle mass is you build it, destroy some of the muscle fibers, and then your body goes in there and restores it and brings it back. Well, that also creates scar tissue. And I'm sure people have seen muscle builders like that can't straighten out their arms all the way or can't do certain things because their range of motion is decreased. That doesn't have to happen. If you get ART, we can keep those moving. You know, same with like runners. Runners, if you're jogging all the time, you're using those same muscles over and over and over and beating them down until they get to the point where they can't do their job anymore. Scar tissue goes in there and tries to help out the muscle, but ultimately shortens it and tightens it up, and we need to get that worked out, and that's what ART does.
Okay, well, thank you for that perspective, and we'll look forward to hearing some more stories on your patients and how they're getting better.